pushing it, like I said, especially with the calluses on the bottom of that one, and
you can still.
You may recognize my voice.
If you if you can feel free to speak, or if you do want to, or if you don't want to, you can see there's a bit of a ram's horn in there. See how it's overhanging and kind of way down there. And then area of these and how they curve under. We can take care of all that. You can talk for as little as much as you want. Actually, a lot of our, did you catch the IPK in there too? Okay, here that'll cause. I'm sure that's plenty sore, so I'm not gonna come and mess with it. I'm gonna just come back and check that out later. So we'll probably start. What'll be easiest? I think we'll start on this side now if you want to get here. Alrighty. So actually, this is the only one that looks like it's not doing too long. Do we need to hit? That's how I look in real life. I mean.
My cousin called me this morning. Oh, you still going? I said, yeah, I'm going. I'm going chicken out or nothing. I got to get this done. I'm trying to get myself together.
I love that for you. Yes, come on by and see me. This is a judgment-free zone.
That's what you say. Until we leave, I bet y'all be falling out on the floor.
We don't. I guess because we see so many folks that need a little extra help, we hardly even. We remember you, but we don't, what is the word that I'm looking for? We don't make a big deal out of it per se.
So if I see you like out at a restaurant or something, you don't say third toe?
Not at all. Not at all. Actually, please say hello if you ever see me out. I really enjoy seeing my patients out and about around town. So if you see me out, please say hello.
Okay.
I can't legally say hello to you first.
Really?
Because of the whole Privacy Act, so I can't acknowledge you as being my patient, but if you acknowledge me first, I can talk to you.
Okay.
Now this is impressive. Now I'll tell you this here.
You should have seen it before it broke. So.
Oh wow, okay. Because you could have caught a salmon from a stream with this one. I may have to get my heavy duty trimmer out for this one. Oh, we're almost there. Oh, I got it. Now, there was one lady I did have a good laugh about because I was trimming her nails and my trimmers broke. Now, if your nails can break, some stainless steel nail clippers, those are some pretty hard nails. That's impressive. Now, I'm gonna clean and trim and peel all down out under here. Get this as clean as possible. I'm not gonna go absolutely crazy. I don't like when folks trim the nails down to nothing, but I'm gonna work on cleaning them out. I'm gonna move on over here. I don't know, should we? Let me see where I can go. I'll start here. I'm just covering them with my hands because you don't want the nail to fly off. The last thing we want is somebody to get hit in the mouth with a toenail. That was also one of my favorite episodes of Martin as well. When, what was it? Cole was cutting his nail? And it bounced off. Now this is something new. Let me slide out of the way here. I don't think I've ever seen an ingrown hair in a toenail. That's interesting. Let me see how it's curved down.
Glad to be able to show you something new.
And you can see right there where it was just kind of digging down in the skin. I'm gonna go and get it all cleaned up. And this one too, digging down in the skin. Oh, yeah, there's another hair caught up under there. Just gonna work our way around.
I was making the appointment, and I saw that the services were like in 20 minutes. I was like, 20 minutes? I was like, you can't do all this in 20 minutes.
So
I
with
figured you were gonna look at it and say, oh, no, you need the 6 hours, 3 to 8 minutes.
Not at all. We're gonna have you all done in probably about an hour or so. The way that the schedule works out, I'm not super tech savvy, so I'm probably gonna have somebody work with me on that. Let me see. I think we got a little something caught between there. Yeah. I'm not really tech savvy, so I'm not good at. Basically, I have it spaced. I spend about 20 minutes with you.
Okay.
But then I have another staff member that'll be with you for about 40, 45 minutes. So we'll clean down in between there. It smells like you got a little fungal infection. Yeah, I can clear that up too. No problem. And let's go over here.
As long as I don't leave in tears, if I don't do that, I'll be here every couple of months.
You might leave tears of laughter, but that's about it. 'Cause I am a bit of a jokester, but then my staff doesn't think my jokes are funny, so.
Bad jokes.
Well, I'm like the same age as your dad, so that would make sense if I had dad jokes, right?
So is it corny?
Oh my goodness.
Is it corny? Or maybe the jokes hit you later as you.
Yeah, I just pretend to laugh.
Oh.
I'm in my dad joke phase, and that's fine. Now I'm about to make a dad joke now because you made a statement about my jokes being corny, and now I'm about to start working on your corn here on the bottom of your face. So see, that's my one little dad joke of the day. Don't boo me off stage and hit me with tomatoes. Let's get to work on that. So this is a little plantar keratoma. I'm gonna find the best place to work. Okay. Am I hurting you there?
Yeah.
I'm sorry. So all I'm gonna do is just slowly kind of work my way around and cut it free. I'm sure this probably pains you a good amount when you're walking around.
Yes.
Okay, I'm about a third of the way there. Happy thoughts for me.
Whew. Don't have none. Oh. Oh.
Okay. Is that a little better?
Yes, a little.
There it is. Okay. So there's the. Oh, dropped it.
Oh.
Pick it up. I'll get a fresh blade anyway. But there's a. And that's solid as a rock.
So what's that?
So that's just a little buildup of keratotic tissue or keratin. Let me change my gloves. I'm sorry, I keep putting my head in y'all's way. Y'all can't see. Then I'm gonna clean out that little area. And then what I'm gonna do is I'm gonna make a little pad that goes in your shoe.
Okay.
I'm gonna do as much as we can stand here. How's that?
Oh.
Is that sore?
Yeah. Oh.
You think you can stand it just for a little bit for me to peel all this stuff out?
I don't know. I could try.
I might have to, I don't want to have to numb you. How's that there? Let me do a different approach. Because I want to get plenty out, but I don't want to
Ow. Oh.
be hurting you.
Yeah.
Okay, there's a good little start. And to really clear that out, I may get a little numbing and numb you up.
Okay, yeah, I got that.
A little bit more speed on my drill. It's just smoothed. Okay. I'm not really going to try to shape them to make them real pretty on the first time. My main goal is to get all these long ones done. And then once I get them where I want them and I see you in a couple months, then I can really put a nice shape to them. But I really do appreciate you driving all the way down to see me. Because I lived in that area at one point in time. I'm gonna come back to this one. I need a special drill for that one. I don't like how long this one is still. This one is interesting. You can actually even see down here where the nail was cutting into the skin. I don't know how well you can see that little groove there. Yeah, that's where the nail was growing into the skin. So after a while, that could actually even get embedded in the skin and you can get an infection that way. I'm glad you came when you did. Those edges. All right. Now, how long has this little doodad been here? This little growth on the tip of your toe?
I can't tell you.
As long as you remember. Yeah, I was asking. I'm more curious than anything. It looks nice and benign. I'm not too worried about it. All right, let's get to work on this big toe.
You think it's something that needs to be looked at?
Not at all. It's been there for a while. It looks like just a little neoplasm or skin growth. No big deal. That down. I'm going to cut a little bit more. See if it's easier to cut now. Oh yeah. Am I hurting you? Alright. Okay, now I'm trimming that back. Okay, that looks a lot better. Actually, the feet are in. Now, how does that feel down there now?
I mean, I still feel it.
It's not nearly as sore?
On this one, but not the other one.
I would guess that it's more, I'd venture to say rather, or hypothesize, I won't say guess, I'll hypothesize, it's more on the way that you walk.
Oh,
Sometimes the metatarsal heads can be a little bit plantar flexed, or basically one of the little knuckles in your feet are pointing down. And as that points down, a little bit of extra pressure goes on that area. If extra pressure goes on that area, you're not very happy. But that's the bad part. The good part is if I can get most of this out and I can make that little pad for your shoe, shoot. Think we're gonna make it?
I hope so.
And a lot of times the first time it's very sore because it's been like that for so long.
Right.
And I just gotta work my way through it. Okay, we're almost there. It's gonna be a little crater down here on the bottom of your foot. But when you take your first step down, you're like, you know what, that guy, he's all right. It's like the equivalent of having a little rock in your shoe.
Okay.
Pull, pull, pull. part of it. That's just as hard as a rock. I don't know if you want to see that or not, but you've got a whole little, practically a divot cut in the bottom of your foot here. Seems like that helped you out a little bit. It's a little bit more numb.
Yeah.
Yeah, because 10 minutes ago you wouldn't even let me come close to pulling at it like this. I probably would have had to let you down for the chair so we could box. Okay. Well, that's on the right foot. So we're gonna get that all cleaned up. I'm gonna have one of my staff members in here to help you out. And then we're gonna segue into this. We're gonna clean them up. Your feet are actually in pretty good shape.
I haven't heard nobody say that in a while.
You're in pretty good shape. They're not going to require a whole lot of work past the long trimming and things that I've done. So now that we got that first part cleaned up and we got some, I got that pad on there, and I might even come and put a couple of drops of super glue on that pad to make sure that it doesn't go anywhere, because I don't want that pad to roll up on you. I want you to be as comfortable as possible, and I want to see before you leave, so when you step down, I can see how much comfort you got. But that probably feels a lot better already.
Yeah, it does.
Oh, shucks. Don't get me excited. Okay. So I have one of my folks in to help us out.